Generalized anxiety disorder definition. It's normal to feel anxious from time to time, especially if your life is stressful. However, severe ongoing anxiety that interferes with day-to-day activities may be a sign of generalized anxiety disorder. It's possible to develop generalized anxiety disorder as a child or as an adult. Generalized anxiety disorder has similar symptoms as panic disorder, obsessive-compulsive disorder, and other types of anxiety, but they are all different conditions. In most cases, generalized anxiety disorder improves with medication or psychological counseling. Making lifestyle changes, learning coping skills, and using relaxation techniques can also help.
Generalized anxiety disorders, it's some sort of psychological disorder and neurotic disorder. It's not a psychotic disorder, by the way. Generalized anxiety disorder, it's related to some important thing or some important factors. One of them that you can find physiological syndromes or physiological symptoms and another psychological symptoms.
For the functional consequences of generalized anxiety disorder, such condition cause marked impairment in the life of the clients. It may prevent them from performing their daily activities.
The prevalence of general anxiety disorders not more than 17% in equal males and females. Anxiety disorders may include a lot of other disorders, such as post-traumatic stress disorders and obsessive-compulsive disorders. Post-traumatic stress disorders, it means that there is a trauma. After the trauma, the patient started to suffering from feeling of anxiety, feeling of fearfulness, and the feeling of distraction.
Generalized anxiety disorder is defined as excessive worry and apprehension about everyday events or the daily events or problems that cause or that is associated by psychic or somatic tension that cause significant distress to the patients. Patients are usually fearful of the normal daily activity or the normal daily activities that may encounter in their daily lives.
Now, generalized anxiety disorder has comorbidity with other mental disorders. For example, there is a strong correlation and a strong relationship between the presence of generalized anxiety disorder and major depressive disorder. Usually, patients with generalized anxiety disorder may develop later on symptoms of depression, which include low mood, depressive mood, feeling of hopelessness, loss of interest. And because of this desperation they have, because with their continuous anxiety, they might develop a full-blown depressive episode, and hence they have a comorbidity with their anxiety. So major depressive disorder is a higher comorbidity with the generalized anxiety disorder. Other comorbidities might include other anxiety disorders. Sometimes generalized anxiety disorder might have a comorbidity with a social phobia, might have comorbidity with a panic disorder. It is not uncommon for a generalized anxiety disorder individual to have panic attacks. So a panic disorder can also be associated or be comorbid with generalized anxiety disorder.
For the comorbidity, such condition should usually be comorbid by other kind of anxiety disorders. So we may find other type of anxiety disorders in clients with a generalized anxiety disorder. As we said, there is a comprehensive apprehension and worry, which is excessive, about everyday activities. Specific phobia is a comprehensive psychic or somatic tension, which is usually restricted to certain places or to certain objects that cause marked impairment in clients' lives. This anxiety may cause clients to avoid such kind of situations or avoid such kind of objects which cause that anxiety.
constant worrying or obsession about small or large concerns, restlessness and feeling keyed up or on edge, fatigue, difficulty concentrating on your mind, going blank, irritability, muscle tension or muscle aches, trembling, feeling twitchy or being easily startled, trouble sleeping, sweating, nausea or diarrhea, shortness of breath or rapid heartbeat in adolescents and children, performance at school or sporting events being on time, earthquakes, nuclear war or other catastrophic events. A child with the disorder may also feel overly anxious to be fit and be a perfectionist, lack confidence, redo tasks because they aren't perfect the first time, strive for approval, require a lot of reassurance about performance.
It's a long list of differential diagnoses, organic, psychological causes, but one of the main differential diagnoses is anxiety disorder, or sometimes called in some textbook of psychiatry as obsessional personality disorder. What is obsessional personality disorder? Symptoms of meticulous, oversensitive person, over-organized person. He wants everything to be done on the same time. He's little bit hesitant, and he's so meticulous about finishing things. For that reason, he has sometimes, or some of them, have obsessional slowness in doing their duties, in their performance, having this slow or obsessional slowness. Those type of person will have some degree of anxiety, but different than generalized anxiety disorder. In generalized anxiety disorder, you have fear of unknown. In obsessional personality, that fear, not fear of unknown, just there is anxiety coming from inside, not from outside. But in generalized anxiety disorder, fear of something coming from outside. In obsessional personality or anxious personality, no fear from outside coming. The fear is coming mainly from inside. And it's not a specific form of fear or generalized form of fear, but feeling of not at ease. It's the best description of obsessional or anxiety personality disorder.
The most important diagnostic criteria in general anxiety disorder is that you can find the patient suffering from excessive worry or excessive feeling of anxiety with significant stress, and easily get tired, and restlessness and irritable, and the feeling of muscles tension or muscle spasm. You can also find that patient who's suffering from generalized anxiety disorder that suffering from hand tremors or hand shaking, and this is very important and significant sign we have to note in patient who's suffering from anxiety disorder. Another important thing is that perhaps the patient may came to the clinic without know the main causes or the main rational causes that make him feeling anxiety. Perhaps he come to the clinic and say, I cannot identify why I am feeling anxious or why I am feeling an anxiety. Excessive anxiety and worry about a number of activity. Numbers of activities that we can find that the patient cannot control himself during dealing with daily routine life activities and social communication life with people around him. It's a very important thing to note several signs and symptoms in patients who are suffering from generalized anxiety disorders. As we said before, one of them is physiological symptoms or physiological signs like sweating, feeling of muscles tension, perhaps that he feeling high temperature in different way or in different situation. Another psychological symptoms and sign that he feeling distracted and he cannot focusing his concentration, and we can also find that there is impairment in his social performance and social communication skills, and with clear poor self-confidence and clear poor self-esteem. And another important thing that you can find that patient who's suffering from generalized anxiety disorders with sleep disturbance, as we said before, in patients who are suffering from panic disorders and panic attacks.
Generalized anxiety disorder actually is characterized by excessive anxiety or fear regarding a lot of topics within the day of our clients. There is a fear, there is also an anxiety regarding a lot of activities within the daily life of our clients. And for the diagnostic purposes, actually, it should be present most of the days of the last 6 months of client's life.
If we can make an observation related to the general anxiety disorders from a side and another specific phobia from another side, we can find that patients who are suffering from generalized anxiety disorders may induce a little bit of specific phobias. Most of patients induce panic attacks, and the panic attacks may occur, as we said in previous episodes, may occur in adolescent and may occur also in adulthood, but it's very rare in childhood, as we said before.
The diagnostic criteria actually for generalized anxiety disorder, according to the Diagnostic and Statistical Manual, there should be excessive anxiety about a lot of topics within the same day, more days of the last 6 months. Such excessive anxiety should be difficult to be controlled. Clients usually find a great deal of difficulty to control such kind of anxiety. And such anxiety, or the focus of such anxiety, should not be due to another anxious one disorder, or for example, another anxiety or worry. And such also excessive anxiety should interfere with the client's quality of life.
Generalized anxiety disorder is a class of anxiety disorder characterized by sense of suffocation and sense of suffocation and tachycardia, heartbeats, sweating, and loss of concentration and tingling and numbness, in which our person complaining from this anxiety disorder, suffering from this anxiety and appearing this disorder in daily lives, in activities, and easily provoked from any situations, from any work. Persons with generalized anxiety disorder, complaining from signs and symptoms are loss of concentration, increase toilet, abdominal pain, vomiting, and distractibility, and increase heartbeat, and maybe somatic pain, maybe somatic complaints, muscle pain, and neurotic pain, and joint pain, and headache.
Generalized anxiety disorder associated features supporting diagnosis. What is the main factors which support the diagnosis of anxiety disorders? One of the most important psychological factors which support the diagnostic factors of generalized anxiety disorders is a mood swinging or the mood disturbance in generalized anxiety disorders, and it's a comorbidity also with the patient who's suffering from anxiety disorders. Another important thing is that the sleep disorders or insomnia in patients who are suffering from anxiety disorders or general anxiety disorders, his feeling of restlessness and he's easily feeling of tired and feeling of exhausted during daily routine life. This is different factors and several factors which support the diagnostic factors of generalized anxiety disorders.
With many mental health conditions, what causes generalized anxiety disorder isn't fully understood. It may involve naturally occurring brain chemicals such as serotonin, dopamine. It's likely that the condition has several causes that may include genetics, your life experiences and stress. Some physical health conditions are associated with anxiety.
Most risk factors that we can find: personality disorders, specific anxious personality disorders, and also we can find mood disturbance as a comorbidity and also as a risk factor. We can also find that the patient has some sort of deterioration at his academic performance and at his social life, and has problem in his sleep. And a lot of patients who are suffering from general anxiety disorders induce the sleep disorders too.
There is a lot of etiological factor for generalized anxiety disorder. There is a lot of biological factors, actually. The hormonal theory, the neurotransmitters are also implicated in the pathogenesis of generalized anxiety disorder. We have also certain psychodynamic issues which should be considered when speaking about the etiology of generalized anxiety disorder.
The main factors which cause generalized anxiety disorders, we can find a significant three causes or significant three factors which may induce generalized anxiety disorders. It's an biopsychosocial factors. The biological factors, it's related to two different factors. One of them is the heredity factors. Heredity factors, most of the recent studies reported that about 3 to 7% of patients who are suffering from generalized anxiety disorders may be caused by heredity factors. And another biological factors, it's related to the endocrine system and the disturbance in the endocrine system hormones or the hormones of thyroid gland. And this is an important and significant result too, related to biological factors too. About the other factors or about the other causes related to generalized anxiety disorders, the psychological causes or the psychological factors. Psychological causes or factors, it may occur during the early childhood and the early adolescent stage. The early childhood and the early adolescent stage may induce some sort of anxiety disturbance or anxiety symptoms when the child or the adolescent started to focus or started to face different situation with stress or different social situation which orders him to do some sort of behavior or to start to feel anxious during the communication with his parent, with his siblings or with his family members. Another important thing related to the social factors. When the social factors started to support the child or the adolescent to express himself and express his will during the society or the social situation, that may in a good percentage decrease his feeling of anxiety. On contrast, if the society or the social factors started to force him to not express himself, that make him feel or increase his feeling of anxiety. Risk and the prognostic factors, it's related to environmental and related also to the genetic and psychological factors, by the way. And we can also focusing about some studies that started to present a clear result concerning the prognostic factors related to suicide risk factors and how it's related to generalized anxiety disorders. Most of the recent studies found that the patient who is suffering from generalized anxiety disorders, a little percentage, which not more than 1% may induce suicidal risk or suicidal attempts or suicidal ideation. And this is a very little percentage and very important also percentage when to make your differential diagnosis and when you started to see the prevalence of the patient who may induce risk factors such as suicide.
The two main treatments for generalized anxiety disorder are medications and psychotherapy. You may even benefit more from a combination of the two. It may take some trial and error to discover exactly what treatments work best for you. Medications, antidepressants, psychotherapy, also known as talk therapy and psychological counseling. Psychotherapy involves working out underlying life stresses and concerns and making behavioral changes. It can be a very effective treatment for anxiety. Cognitive behavioral therapy is one of the most common types of psychotherapy for generalized anxiety disorder. Generally, a short-term treatment, cognitive behavioral therapy focuses on teaching you specific skills to identify negative thoughts and behaviors and replace them with positive ones. Even if an undesirable situation doesn't change, you can reduce stress and gain more control over your life by changing the way you respond.
There is a lot of treatment modalities for generalized anxiety disorders. Biologically, we usually depend on antidepressants, and sometimes we may use minor tranquilizers. The use of psychodynamic interventions are of crucial importance for the management of clients with generalized anxiety disorders. Clients should be rehabilitated again as a general rule when we are speaking about any type of anxiety. So clients with generalized anxiety disorder should be evaluated, also should undergo both pharmacological as well as psychological intervention.
Cognitive behavior therapy with patients who are suffering from generalized anxiety disorders used to start with assessment to the generalized anxiety disorders. You can use some sort of psychological tools which assess or evaluate anxiety disorders, such as Teller Anxiety Scale. Teller Anxiety Scale, it's a test that make a clear degree to what extent the patient suffering from physiological symptoms and physiological sign related to anxiety disorders, and another psychological sign and symptoms related to anxiety disorders, by the way. And what this degree, it doesn't mean. It doesn't mean that the patient his degree classifies him within mild anxiety disorders or classifies him in moderate anxiety disorders or severe or chronic anxiety disorders. Another step after you make your assessment to anxiety disorders, you started to make a thought record or thoughts observation. What is the main negative thoughts that may induce anxiety or feeling of anxiety? According to the behavioral and the cognitive model, that there is situations, this situation or experience may induce schema or negative automatic thoughts, and this kind of negative automatic thoughts induce negative feeling such as depression, anxiety, feeling of phobic, and then they induce negative behavior or negative reaction. And this is the cognitive model, so that when you try to treatment patient who is suffering from generalized anxiety disorder, you will focusing about his automatic thoughts. Automatic thoughts make a correction to this automatic thoughts. What is the main evidence which support this kind of negative thoughts? You can find nothing support this automatic thoughts. And what is the alternative thoughts which enhance his feeling, which enhance or make him feeling positive? And then what is the much more evidence which supports the alternative thoughts in patients who are suffering from generalized anxiety disorders? Another step, and which is very significant and important, and we said before in previous episode, in specific in panic attacks, in patients who are suffering from generalized anxiety disorder, we have to make a behavioral techniques. One of the most important behavioral techniques, the progressive muscles relaxation, which related to the situation which induce anxiety disorders. Another important thing in behavioral or cognitive behavioral treatment or cognitive behavioral therapy, the psych education, and then the follow-up, and then the reassessment of the general anxiety disorders?
Generalized anxiety disorder is a disorder where your anxiety is not triggered by any one specific thing. You could call it like a free-floating anxiety, that your anxiety is triggered by any number of things, and that makes things really quite difficult. You can be quite stressed for most of the day when you have generalized anxiety disorder, and it's also more tricky to treat because there's no one specific cause and you can't relate it to one particular thing. It's very difficult to just focus on the automatic thoughts. In cognitive behavioural therapy, you would focus on someone's automatic thoughts for their anxiety and treatment to help make them better, and you would find that most situations they'd be triggered, most anxiety symptoms would be triggered by a specific situation. Now in generalized anxiety disorder this isn't the case, so you may have to go further as far as the treatment goes and think about what the core issue is, what they call core schemas, core beliefs that you have about yourself and the world around you, and try and focus on those in terms of treatment and therapy to get any long-term change in how you are. And so it might be related to beliefs around a fear of perhaps being on your own, a fear of not being good enough. They're more general fears, not specifically related to any one particular situation. The medication is similar to other anxiety disorders. Again, the recommendations these days is to not focus on medication too much, because medication for anxiety disorders can be quite addictive, and doctors typically would not like to prescribe that for more than about 2 to 4 weeks. It can be very difficult medication to come off as well. And again, you're not learning to deal with the anxiety with coping strategies. The medication is just taking the edge off of the anxiety and the fear reaction. And what you need to do for long-term intervention, for long-term care and changing your life, is to learn psychological techniques, to learn relaxation techniques to help you live a more fulfilling life.